Cholesterol does not discriminate against age. It's not a middle-age problem anymore. Young children, school-age children have it now because probably of our diet, the SAD diet, which stands for Sad American Diet. Probably one of the major reasons behind high cholesterol these days. But then there's also genetics, which is something you can't necessarily change, but you have to acknowledge and be aware of that. And that's one of the things I think a lot of people don't know about cholesterol. Hello, my name is Dr. Jennifer Tutt. I'm a physician here at PartnerMD, Sandy Springs. And today I'm going to do my best to try to help educate you on cholesterol, what it means, what it does, and how can it impact your life. Well, people need to understand that, cholesterol does affect your heart health, but it can also affect many other things as far as your overall health. It can affect your brain. Yes, it can increase your risk of strokes, just like it can for heart attacks, but it can also affect your memory and your cognition. It can affect your kidneys. Kidney disease is affected by many things, and cholesterol is one of them. It can affect your sexual health. It can affect, for women, their menstrual health. The list goes on and on. Genetics is probably one of the biggest things, and it's unfortunate because you can't change genetics. There are some genetic predispositions where your body holds on to too much cholesterol, which in that instance, you can be the most healthiest individual, you can exercise, eat well, not have any weight issues, and still have a cholesterol issue. That's hard to deal with, but it's just as important that to address your genetically influenced cholesterol, just as if you had high cholesterol because of a bad diet. The good cholesterol is best known as the HDL cholesterol. In medicine, we always tell people to know your numbers, and the magic number, if you will, for HDL is roughly 50. And so it's best to have your HDL be above 50 if you can do it. And quite often, you can get a higher HDL with regular exercise, 30, 40, 50 minutes a day, most days of the week. And then as far as bad cholesterol, I think of the LDL cholesterol. It's the type of molecule that will stick to the insides of your artery. There's also a form of LDL called the apolipoprotein B, that's a long one, Apo B for short, that will stick but also penetrate into the walls of your arteries. All that negative activity can build up and cause plaque. And if you have too much plaque, your arteries start to close up. When they close up, you start having heart attacks or strokes. If your LDL is above 150, that's my personal threshold to start talking about medication. And then in addition to the LDL, we look at other factors. What other kind of disease problems do you have? If you're diabetic, as a diabetic, you're 4 times more likely to have a heart attack or stroke. And so with that type of situation, you really need to be more aggressive with getting that LDL down. Also, there's certain calculations out there that look at your age, your blood pressure, your gender. Lastly, at least for me, there's a test that's actually a CAT scan or CT of your heart. It's called a heart CT, or also known as a calcium score. And what that does, it takes a CAT scan of your heart. It looks at how much calcium buildup you might have around your coronary arteries. And the more calcium you have, it's likely the more plaque you have. So if you have a lot of calcium, or what we call a high calcium score, that also helps us figure out your cardiovascular risk and how aggressive we need to be to lower your cholesterol, particularly the LDL. Quite a few patients are hesitant to consider medication. There's a stigma about being on cholesterol medication. If that is how a lot of people feel, then a lot of the onus needs to fall on your shoulders, which is something you want to hear. But it sounds, it sounds tired and true, but you have to get the nutrition. It's so important that the nutrition is key. Foods that are not processed, foods that aren't fried. All these things are easy and all these things taste wonderful, but those types of foods set you up for things like high cholesterol, diabetes, you name it, it all goes together. And so for me, that's probably one of the more important things that you can do on top of regular exercise.